So we'll get started. I'll call the meeting to order. Good afternoon, everybody. This is Thursday, June 18th, 2020, the 1 o'clock meeting of the Board of Health. Just like to remind everybody, the meeting is being recorded by video. We'll get started. I'll call the meeting to order. Good afternoon, audio. And also remote participation is also available pursuant to the Governor Baker's March 12, 2020 order regarding open meeting law. Provisions for these meetings have been provided and also provided for public comment, and we'll do the best to monitor that while the meeting goes forward. So for attendance purposes, by roll call and for the record, when I call your name, we'll just say that you're here. And we'll start with the board members that are present at the moment. Malcolm McNabb.
Yes.
Jim Cooper.
Here.
I'm present, Steve Bisco. And we also have a new select board attendee, who's Melissa Murphy. Welcome. Melissa won't be able to vote on anything tonight, but it'll be after the 30th, but she's going to attend. We also have Andrew Bezos, who will be presenting something this afternoon, and we Roberto.
Yes.
Director.
And I believe Rob McNeil is here as well from DPW for the variance.
Oh, hey Rob.
All right.
So I'll turn it over to you, Roberto.
Absolutely. So I know the first thing on the agenda is actually Dr. Bezos. We have Andy here from CrowdRx. Do you want me to share my screen, or do you have your screen, Andrew?
Yeah, why don't you share yours, Roberto, because I'm not so nimble with this stuff.
Okay. Okay, so let me pull this open. Let me see where it is. Wrong presentation. You just make sure that I have the correct presentation open.
Sure.
Okay. And of course, there we go. So I'll run through this as you need.
Great. I'm seeing the town slide right now.
Oh, okay. Interesting. Better?
Still, what is everyone else seeing? I'm seeing the town COVID slide.
Yeah, that's what we see, I think.
Huh. Okay, sorry about that. That's my fault.
Let me see. If you talk me through it, maybe I can figure out how do I. Oh, there you go. Perfect.
There you go. Sorry about that. I clicked on the wrong one.
No worries. So, if Roberto, if you'd like, I'll just say hi and introduce myself.
Absolutely.
Sure. So, my name's Andy Bezos. I've been had a house on Nantucket for 15 years and been coming there with my parents for over 20. I'm from Springfield, Mass area originally. And my career has moved in different ways. I'm an orthopedic surgeon. I've had privileges at the hospital for many years. I don't do a lot in the summer. I try to help out where possible, but most of the time I'm trying to get some vacation time on Nantucket in the summer, but I'm always happy to help out as needed. Part of my career has turned towards a company called CrowdRx, where we do event management, medical coverage for large capacity gatherings. So we have an expertise in keeping big numbers of people healthy, typically at sporting events like Madison Square Garden. We're doing the US Tennis Open. We do festivals across the country. And during this crisis, festivals and events have stopped happening. So we've pivoted our expertise into helping venues, companies, businesses reopen in a safe fashion, schools, et cetera. So through some mutual introductions, I was introduced to Roberto, and he thought it may be good to share some of what we're learning and still learning every day about ways to come out of this virus healthy and safe as best we can. And we have a program called CrowdRx Go, or Game On, which looks to use all types of techniques to try to restart things safely. And being an island person for a long time, or a part-time island person, Nantucket is in a unique position because it is isolated. It does have very few entry points to the island. And we do screening, for example, for large residential and large commercial buildings in New York City, and for large capacity venues with lots of entrances. And so some of the techniques and things that I've learned in those areas may help the island. My goal today is just to tell you what we do and see how I can help purely as a fellow island person. And I'm sure you've spent lots of time thinking about it, and everybody has their area of expertise. So I'm here just to be a sounding board and a resource, however I can fit in. Roberto, if you advance the slide.
There we go.
Great. And we have a big team, a national team. We have people in at Hopkins that are first and foremost in the public health sector. Matt Friedman, who you see there, is head of the emergency room at Maimonides Hospital, one of the big hospitals in the city. He has been slugging away on the front line with COVID patients now for weeks and months. He's given us an advanced insight into some of the things we see medically to help predict COVID cases even before they're clinically symptomatic. Next slide. You can go fast through these. This is some of our backgrounds. You keep going. Next. Right now, we're helping all these places, trying to get them going. Again, from casinos to stadiums to residential and again commercial real estate. Lately, we've had a focus on the private schools and colleges. They're figuring out how to get all their people back from all over the world and get them sometimes tested, but trying to keep their campuses sterile and disease-free. Next. We're part of a big parent company called Global Medical Response. So we have 35,000 people all over the country. And these are all the facilities that we're currently working on, the types of facilities that we're working on to keep safe in this climate. And again, ever-changing landscape, that couldn't be more true. Every day a new test comes out, whether it's saliva, lower nasal swab, upper nasal swab, antibody test, 5 different machines for each. They all take a different amount of time. They cost a different amount. Some cities pay for it. Some insurances pay for it. It's a nightmare to figure out. And I've been trying to understand it for weeks at a time. And I'm still maybe halfway there. Next. This applies to our stadium work. We're talking about social distancing in the setting of large capacity gatherings. That's just one of our layouts. Next. Several steps to our program, starting with a consultation to understand the particular needs of the place, our island. I understand it from my perspective as a recreational summer resident, and I understand how to get into the island and how to get off the island. But you guys know a lot more than I do about some of the intricacies. So again, I'm just here to help. Next page. Screening came up in our talks to Roberto. We do a lot of thermal screening at everywhere from airports. We do airports across the country, including the closest ones are JFK. And we do many businesses as people enter. We're restarting stores with thermal screening. I think the important thing about thermal screening, again, there's 1 million cameras, there's 1 million threshold temperatures that we accept. But you need to realize that thermal screening is only part of the story. What we've seen is that oxygen saturations are really one of the early signs. You start to drop your O2 sat way before you get symptomatic. So depending on the setting, we will add that. It's a simple pinch clip that goes on your index finger and very quickly reads your oxygen level. We have questionnaires that we ask people at the same time. And most importantly, we have a nurse navigation program surrounding this. So if someone does have a fever or they have symptoms or an HR person needs help with what to do about, John or Jane was tested positive, who do we need to talk about? Who do we need to contact to do further screening. So there's a big medical support system behind there. I find that business people, it's tough, even HR people, this is such a new area that we're there to give them expertise and to lay off some of the responsibility for these difficult decisions. But screening, and whether that, in our case at Nantucket, is at the airport when people land or before people get on ferries, it's something to think about. It's easy. It's certainly good optics for the public to know we're checking them out. And places like Nantucket, for people that want to get out there in the summer, they may push the window a little bit, and even if they're not feeling well, want to come out and say, you know what, I'm going to recover on Nantucket. If it's a sporting event like a Yankee game, you're generally not going to go to the game if you're not feeling well. But if your whole family's going on a trip, sometimes you'll tag along and maybe not make good decisions. So we're there to make people aware that they're being checked, and to make people think twice about how healthy they are, or maybe they're not. And we'll pick up people with a temperature generally over 100.1 is our threshold. And all that means is they get pulled aside for a secondary survey, talk about how they feel, where they've been, check their oxygen, etc. Next page. I think the big answer for opening up businesses and for keeping people as safe as possible is the much more available testing that's out there. On island, we've done a couple of private places with swabbing to look for really surveillance testing to look for a disease in people that have come onto the island, or even people that have been there year round. But a lot of our summer population is new to the island, and nothing is perfect because you can contract this disease the hour after you have your swab test. But certainly a surveillance screen for employees is really a great start. Antibody testing is nice. I think it's interesting to know whether you've had the disease or had exposure. It does, all the science points to the fact that it gives you protection from spreading the disease or getting it again, although the CDC has not come out and said it. We do know that from science that should and is the case, and it may afford that employee some different consideration in terms of where they're placed, especially facing the public, or maybe behind the scenes, or if it's food services, etc. We are starting another program where we have bracelets that have a QR code, which will have verified data on there and show COVID testing status, antibody testing status, simply by waving a smartphone over it. If you want to update your testing, you can get it again and it'll show your updated results. And it's also an optical cue to people that you've been tested and that you care. And so a lot of our private employers are finding that very helpful in this setting. Next page. This is stuff everyone pretty much knows at this point, but we can advise on this for the town or for any other people that are interested. There's some innovation in this area, but we've pretty much evolved into pretty standard gear for PPE. Next page. That's really more for the garden, for stadium and arena type stuff. I don't think we're holding mass gatherings on Nantucket this summer. We do have spatial consideration recommendations for restaurants or those type of facilities if that's needed. Next page. Disinfecting practices come a long way. We sort of know the best practices here. I think most good employers have learned this already, and there's some great cleaning systems out there. Again, if someone wanted to call me and say, we're using this, what do you think? I could run it by my team, but most of the industrial grade disinfecting practices are well known and out there. Next page. This speaks right to this meeting, but in a lot of our cities where there's large capacity gatherings planned, we will work with local municipality, state, and big leagues to come up with plans for reopening. And in the setting, I'll give you an example. We're doing a professional sport in New York that we're reopening with sequential testing and tracking. And that's being used as an example for the league. There's lots of factors that are at play right now about getting sports back in our country. Unfortunately, many of them are financial, but we really have some good protocols to handle the infectious disease part. Next page. This just discusses our support. Like I said, if somebody gets flagged in a company, on the island, wherever, it's going to set off a whole bunch of tracking that needs to be done, contact tracing, all those things to nip it in the bud, to test people all around them, to see where the testing has been. We have a 24/7, again, nurse navigation line where a call can be made and a medical person will get on with expertise in what to do next. Next page. That's pretty much it. We're led by doctors. We're not an ambulance company. We're not a security company. It's everything we do is really we want to share. There's no secret sauce here that we want to keep. Everybody is learning. So my special goal for Nantucket is not as a business person, but as a resident and someone that wants to have safe fun on the island and see others do the same. So that's pretty much it.
Okay. So I'm going to go ahead and stop the sharing so that we can see everyone and all the attendees. So first off, this is a program that we have available here on the island. So we wanted to make sure that you as the board heard it and had any questions. If you had any questions, get those questions answered. It's definitely an option. It's a tool in the toolbox. It is a conversation that the board has to have. Obviously it's going to have to go through us, the board of selectmen. If we decide to do any of this, it's just I wanted Andrew to definitely come here and discuss the options with you. It's a public health crisis right now, so it makes sense that the Board of Health is the one who hears it. So right now, I just want to open it up for questions.
Malcolm?
I have a question about thermal screening, because a lot of people have, I know some organizations on this island are starting to do it, but you know that we're still going to miss an awful lot of people who may be in their early stages of infection. So is it really that worth the effort?
A great question. You're going to miss the majority of the people. So 70% of people with active disease have no fever. So this is, I agree with you. It is not definitive. It's not conclusive, but it's all about putting layers of screen. It's like a Swiss cheese. You know, you have to get through all the holes to make it through. So one easy way is thermal screening. Even if you knock out 5 or 10 or 15%, it's easy, quick, and cheap to do. I talked to you about the oxygen saturation. That's another screen. The questionnaire is a screen, but people are going to put down what they want to put down. It is absolutely not the be-all, end-all, but it's optics, and it gets people to think, and it gives people, I think, reassurance that we're doing everything we can.
I agree with that. A lot of it is almost public relations and insurance, but I've been trying to read a little bit about the oxygen saturation. And is there any well-designed trial to really show its value? Because I remember early on, there was a lot of people said we're all going to find all the virus with that. And then there was people who said no, et cetera, like anything in medicine.
Right. A study just came out, I think today, or I was reading late last night. We kind of knew it from our clinical experience. They looked at respiratory rates, sleeping respiratory rates, which are typically around 14 breaths a minute. What we're seeing is 3 days before active disease, that respiratory rate climbs up to around 18 breaths per minute. So it's a pretty amazing phenomena. We've also seen clinically in the hospital that you will have someone texting, talking, seemingly normal in front of you, and you put an O2 sat on, and they're in the 70s or 80s, and then they drop to a certain number, and they literally crash right in front of you. So it's pretty well documented that that is a harbinger of the disease. But are we going to, count people's breaths at night at home in Nantucket? I don't think so. There's some wearable technology you can do to monitor your rate. But I think attention needs to be focused equally to O2 sats as it is to thermal. Thermal, just everyone's grabbing. Thermal security companies are doing it. They're not asking the right questions. They're doing it in full sunlight. There's all kind of factors.
Right. Where was the O2 study published?
I think it was New England Journal of Medicine. I read it at about 2 in the morning last night. If you email me offline, it's my email is abazos, ABAZOS, @crowdrx.org. I'll shoot it to you.
Yeah, if it's New England Journal, I have that.
Yeah, great.
I don't read them all the time.
I skim them pretty well.
They tend to stack up.
They do. So do mine. Well, they don't stack now because they're electronic for me.
I'm an old-fashioned guy. I like paper.
Yeah, I'm somewhere in the middle.
Anybody else?
Thank you.
Other comments for Andrew?
Well, I'm available. I'm available anytime. It's a passion for me. You have my email, and Roberto has my information. I am looking forward to being on island tomorrow after surgery through Monday and much of the summer. So feel free to use me as a resource in any way, any part of that whole program. This isn't intended to be a sales pitch, only it's offering services, and I'm just trying to help out. This is a learning a learning event every day for us, as you guys know. And I'm hopeful the testing changes and we can get a really accurate rapid test. Right now on the island, we're swabbing. That is really the gold standard, and we're getting a 24-hour turnaround. And I think antibodies are nice to get. So that's it. I wish I knew more, but every prediction I've made in this thing has been wrong. So I'm wrong almost as much on this as I am when I get home every day and with my kids and my wife. So let me know what I can do.
Thanks, Ian.
All right, take care.
Thank you, Dr. B. I really appreciate it.
Thanks. Bye-bye.
Bye. Okay, and then just real quick, I'm gonna do one of those, my 5 sliders, just so that we could get through the rest. Let me make sure I have everything queued up so I don't end up doing the same thing.
All right, ready to go.
Andrew, you're still live. Okay, I muted him. Of course. Okay. Okay, and we, just to make sure we're seeing the COVID thing, right?
Right.
Okay, thank you. Okay, so just real quick, wanted to discuss what we're seeing with the testing. So far, the total PCR tests here on island to date are about 1,140. That includes the OIH and the Sherburne Commons tests that we had done. So far, it says 0 positive tests. I'll get to that in just a second. I just realized that can be confusing. The number of PCRs tested by the town funding so far have been 23, which I should have put the price here. So at 23, let me just do the quick math, which so far is only $3,400 of the funding. We are starting to create a reach out flyer, an outreach flyer, so that we can get to the people who are mostly qualified. We're looking for the highest risk individuals. So frontline groups of people at grocery and convenience, home health aides, things like that. You may have heard me discuss it at the select board yesterday. So it still says insert there. I forgot to put that in. So number of PCR tests covered by the private employers. So far, we've had approximately 85 people who are testing, which is great. So we're hoping that employers do cover so that we can get more information out there. The more information we get, the better. Just like Dr. Bezos was just saying, that it is open, and that the more information, the more active surveillance we have, the better for everyone. of the newer program with the employers as well as the grant funded group, we've had 0 positive tests. So that's why you see that 0 there. We all know that we've had 14 positive tests on the island since the beginning. That is odd. So we had the discussion of the metrics from before. These are the state metrics that we've been using. We've adapted them for Nantucket. So what you're going to see here is that when it says the COVID positive testing rate, we want to keep that number below 10%. So it's the people who are showing symptoms that are coming up and they still get a positive number, that we want to keep that less than 10%, because if it is 10%, we're getting a much higher rate of infection than we were hoping for. And this is actually the same number that the state uses. Currently on Nantucket, that is down to 1% of all tests. Number of individuals who have died, you want to keep that below the 5%, which is what these are people who are confirmed positive that are dying from deaths caused by COVID. So right now that number is below even half of 1%. So we're in great shape there, knock on wood. Number of patients with COVID-19 in hospitals, I chose 10. We chose 10 on this one because the hospital has the 14 beds, but we can't take the entire hospital's capacity. And that is if the hospital cannot transfer them off island to MGH. So it's right now there is still the ability to transfer because the state of Massachusetts has gotten so well at bringing that curve down. We need to maintain that. And then the last 3, this is more of a mixed methods type of metrics. The last 3 are actually more qualitative responses. So when we say the healthcare system readiness, how ready are they to accept the surge of patients? Right now, statewide, they're saying that is that yellow number, the yellow color that is saying there, that says they are ready and they can accept patients and they're not in bad shape, but some hospitals are still using surge capacity. In Nantucket, currently that number is, that color is green, where what it means when I say yes is that yes, our hospital is ready. It's the conversation we've been having and you've been hearing from the hospital. The testing capacity is also qualitative, is how able are we to continue testing and to handle any sort of surge capacity for testing. It is also a qualitative question. Currently, yes, we do have the testing capacity. Same with contact tracing. We are part of the state's contact tracing collaborative. We did reach out and connected with them. So on top of the 25 people that have volunteered here, to work as contact tracers if we need them, we can also talk to the cadre of the School of Public Health students across the state of Massachusetts that can do contact tracing in the situation that we get too overwhelmed. So our next step is to get these COVID educators up and running. We have interviews tomorrow. So we should be able to get them onboarded as soon as possible. You may have heard Libby mention the kits that we were going to be giving. I had a few questions about what those kits will entail. So real quick, the kits will be masks. We're going to try to make up some postcard type brochures that have a QR code and links that people can pull to videos and things like that, as well as information about mask wearing, social distancing, and COVID. It'll most likely take you to the town website as well. The kits will also have some hand sanitizers for themselves, big bottles, that in the situation that they need to use hand sanitizers or somebody requests a little bit, we can also give that to them. The reusable water bottle, a hat, and a COVID t-shirt, the Nantucket t-shirt, to show people that they are the COVID educator so that we can get information out. We are hoping to get people out in the downtown area. Some days, on the nicer days like today, we will be able to get them over to some of the beaches and get information out, especially during the bigger holidays when we're starting to see surge of people out. And then lastly, we're just going to be maintaining vigilance. We're going to continue testing and we're going to continue doing our inspections. We're responding to all our restaurants and retails as we get the phone calls. We're seeing a lot of people without masks downtown, some of our off-island visitors. When and a lot of them have been really good when we respond. We ask, can you wear a mask? Some have said, oh, absolutely, sorry, it's been in my pocket. Other times they say things like, oh, I left it in the car. So the COVID educator will say, well, now you have one. They'd be able to pull a mask out and say, well, you left it in the car, use this one in the meantime. If we are saying that if at any moment people get belligerent, they use choice 4-letter words to us, which has happened, we're just saying, just de-escalate and walk away. It's not worth getting into an argument or a fight at this point, especially if you're outside. We have provided information to all our retailers, as well as our restaurants, all our permitted establishments, to provide the face mask paperwork and flyers. So we believe that a lot of restaurateurs are getting really good at saying, when you come in, you have to wear your mask. We're not going to let you in. We're not going to seat you until you have your mask. Once they're seated, then people are taking masks off because they are outside of that 6-foot barrier. The tables are 6 feet apart from each other at a minimum. And with that, I will take any questions. We're in good shape. So I'll stop the share so I can see everyone and anything you may have. Yes, Malcolm.
I mean, we've tested Sherburne and Island Home, but what about Landmark and Academy Hill?
Yes,
I would think they're certainly vulnerable population and they haven't been tested.
Yeah, they're definitely one of the vulnerable populations. So we're looking to reach out to them and get them tested under our grant funding.
Melissa?
Thank you so much, Steve. Roberto, I just had a couple of questions with the highest risk category for the testing. Will that definition of highest risk worker change as we open up? I'm just starting to think about, restaurant employees. They're going to start to be seeing possibly, 100 guests a day or in and out of restaurants. So will that definition shift as we move through the phases?
We're hoping to do so. Yes, it's the limiting factor right now is the funding. So once we are looking to expand that, and we are also hoping that some groups are willing to pay as well, pay for themselves. But if they can't, we will be able to fund them.
Thank you. And I'm sorry, I just had one other question. With the metrics that you shared, those all seemed to, there seemed to be like the category of the goal, less than 10%, less than 5%, less than 10, and where we are at. Are we also monitoring the Cape and the state? I know early on it was a concern, not just our own hospital's capacity, but the capacity of hospitals in Boston where we may be sending patients. So are we using that metrics too?
Yes, absolutely. So I'm going to do a real quick screen share on that because it is something we're definitely using. So you are seeing this, right? The state. Okay. So what you see here is actually, this is the same metrics group that they're using. This is also the same numbers that you see on the whiteboard behind me every day at these Board of Health meetings and the Board of Selectmen meetings, Select Board meetings, sorry. These are the numbers that you see me posting. However, this same dashboard, which is available on the mass.gov website, takes you down from confirmed and probables, which is in epidemiology terms, what their indicators were for the past few days, in the past week, what surge capacity is. It goes to cumulative confirmed, molecular testing, antibody testing, how the counties are doing. Here we go, Nantucket is right here. It's that green line right at the very bottom. It basically looks like the x-axis, which means we're doing a great job. It shows our prevalence, cumulative numbers for the hospitals, the hospital admissions. But to give you a general idea of to answer the question you're asking, breakdown by age group, standard incidence ratios, deaths, count by county, underlying conditions, race and ethnicity, long-term care facilities. But here is probably the most important part. It shows us what hospitals have patients where and how what their ability to handle these surges are. So, and it goes through the whole thing. And then they also go through the state corrections facilities. And then at the state website, so I'll stop sharing here. At the state website, it also shows you where the hospitals that still have capacity are. So we're using that dashboard, and they publish that every single day. They have a department, their Department of Public Health is about 300 times bigger than ours. So they're able to really handle this sort of thing. But it is very effective.
Steve?
Yeah, go ahead, Jim.
Roberto, do you have any idea how long the island home will be under self-quarantine?
That's a very tough question, because it's a big portion of the reason we've been able to keep a number down to 0 is by that self-quarantine. Mm-hmm. We are still seeing some pretty significant number growth in the states and counties that feed Nantucket with visitors in the summer. Florida has seen perhaps the worst week in this COVID crisis in the last 7 days. And they're a major portion of our summer population. New York is still doing very well, but some of our other states as well, Texas as well, they've had some of their worst. So we're monitoring where our population is coming from. If you remember the Nantucket data platform's information on where our summer visitors come from, we're monitoring those states, those big ones that they had given the information on. I can't give you an exact number, but we are still recommending that OIH stay closed.
Okay, thank you.
Yes.
Any other questions for Roberto? Thanks. We'll move on to review of the minutes from May 21st of 2020 and June 4th, 2020, with any additions or comments, corrections? Seeing none, can I get a motion to accept the minutes?
I'll make that motion.
One comment. There was one of the minutes, there was some yellow about the note taker couldn't hear something. Did we get that corrected?
Oh, we should have gotten that fixed. That one shouldn't have been the one I put up. I'm sorry. That's my fault. Yes,
that's fixed.
Yes.
Thank you. I'll second that motion.
All in favor by roll call. Jim Cooper.
Yes.
Malcolm McNabb.
Yes.
And Chair Steve Visco says yes. Okay, next up, fee waiver for DPW 7 Nobodere Farm Road Fieldhouse.
Excellent. Rob is here to answer any questions that you may have. This is the field house that was approved at town meeting, the funding. It's going to greatly increase the comfort and usability of the Nobodere fields out there, and they need a septic system. We are in the process of permitting it, and we are working with Leo Azadorian and Rob at DPW, and we recommend passing this fee waiver because it is for the town. Rob, if you have any comments or questions here.
Sure. I appreciate having the opportunity to speak to the board, so thank you for that. The project itself is a rehash of the original Nobodere Fieldhouse project, CPC funded from years ago. It's been pared down to simply a open floor plan with a small porch on the back. It's a concrete slab and has 3 bathrooms, a male, a female, and a family bathroom. All told, it's just over 2,000 square feet, 2,031. And the field house portion, the open portion is 1,451 square feet. The remainder taking up the 3 bathrooms and the covered exterior porch area. So it's very bare bones basics. As Roberto mentioned, this is intended to just give folks shade and sun shelter for the more intense uses of that entire facility. This is specific to the septic design, obviously, and the last design incorporated a potential for food prep and a commercial kitchen. This current scenario and ask and design does not.
Anybody have any questions for Rob? No, I mean, this is a town property. It's a no-brainer. So take a motion to accept the variance of relief of the fees.
I'll make that motion.
Take it a second.
Second,
Okay, all in favor by roll call. Jim Cooper,
Yes.
Malcolm McNabb,
yes.
and Chair Steve Visco says yes. Thanks, Rob.
Thank you, Rob.
Thank you all. While I have the board, if I may, Mr. Chairman, I would like to simply continue the conversation regarding the hauler regulations. I know not at this moment, but as part of preparing to have that continued conversation with your board, I'd like to invite the individual members to reach out to me to schedule a tour of our landfill facility. I'd like to take that opportunity during its most intense use during the summer to be able to give you a firsthand tour behind the scenes of what actually happens over there. So I just wanted to extend that today while I have time with you.
Great. Well, will you let us know like what the time and date would be? I look forward to it. Yeah.
Yeah, what I'd like to do, Mr. Chairman, is basically just extend it at the convenience of the members. So if, for instance, I mean, generally normal business hours would be fantastic. I'm in the office from 7 to generally 7 to 7 daily, but 7 to 3:30 is when the folks are here. So really anytime in that period, if you'd like to email me, or if you prefer, I could reach out to you and email you to pass that on, and then just have the members get back to me and I can schedule it individually.
Yeah, I think we could do it sometime after in July when we get the new members on board and find that everybody has a minute to do it.
Sure, that'd be great. Thank you all for your time.
Great, thanks, Rob. Okay, is that the next one on changing of the Gallagher loan to Nantucket Shell LLC?
Yes, so this one is a loan that we've already done. It's already recorded on the property. They're just moving the property into an LLC, so they need to formalize the name of the loan and the note. However, we can't change the name without a formal vote from the board. It's not a problem for us.
So it's not actually a sale.
It's not a sale. No,
Okay.
he is packaging it into his LLC.
Okay.
Take a motion for that request to change the name.
I'll make that motion.
And I will second that motion.
Okay, by roll call vote, Jim Cooper,
Yes.
Malcolm McNabb,
Yes,
and Steve Visco, chair says yes. Okay, next, variance request for the farmers market to have non-food vendors.
Yes, so with the farmers market, with the food vendors, it's really kind of an interesting situation. So they've always had non-food vendors at the farmers market. It's actually really kind of funny that this year, the COVID situation, the State Department of Public Health has said originally had said in phase 1, farmers markets can move forward with food only. And then now with phase 2, they're saying farmers markets can add non-food vendors, but it requires an approval from the local licensing authority, a permitting authority. So it was interesting in one of the phone calls that we had with the state, I, as the agent, technically can, but they recommended that a formal vote from the Board of Health happen. So it's continuing with the same process they've done every year, where they have jewelers, they have artists, things like that. It's just this year it requires a formal vote from you.
So moved.
So exactly, we have no objection to it.
Second.
I'll second that.
Okay, all in favor to approve that by roll call vote? Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
and Chair Steve Visco says yes. Okay, any board member updates or concerns? Malcolm?
Mr. Chairman, I think it's great that we have the with the lowest number of COVID diseases in the state, our county, but we also have to remember we're often the highest for tick-borne disease. So I don't want us to forget that. So what are we doing? Do we need to write a letter? Do you want me to write a letter for the board, or what would you do? Because I'm afraid that everyone has forgotten about that. And in fact, I'll give you a quick story about a colleague of mine who was actually thought to have COVID disease. The physicians were so convinced he was, even though he was having trouble testing for it, he eventually turned out to have anaplasmosis. So it's still there.
On my mind too. I was actually thinking about bringing it up today about the ticks. I just happened to see an email I was going through from Charlene Chadwick in 2012, and I was amazed at all the number of people that had contracted a tick-borne disease. And yeah, we don't want to forget about it.
Absolutely. No, absolutely. I think a letter to the editor would be very effective, as well as I'll do a renewed push on social media and on our website for tick-borne illness. I think you're absolutely right. And we had a particularly mild winter. So not only is COVID on people's minds and not tick-borne disease, but also the ticks are going to be even more active this year because of such a mild winter.
They've had a nice rest.
Exactly.
So if it's all right with the board and the chairman, I will draft a letter, and then if Roberto and the chairman will review it, I'll try to get that done by Monday so it could go into next week's paper.
Sounds good.
I will do my best if I can get to it.
Steve?
Yeah, go ahead, Jim.
I have something on the variance for the food code for the tap room.
Oh, that Baron was withdrawn yesterday.
Yeah, they withdrew that. I think I crossed.
Oh, they did? Okay.
I forgot to mention that.
Okay, no good. That's good.
And one of the big things that we definitely want to do is I would love to thank Helene Weld for her years of service on the board. We have a very great team, and yesterday the select board voted in Meredith Leppery to be our member, and we voted in Steve Visco to be our members for the board. Melissa is here today as well. So we want to thank both of you for all your years of service, Melissa for your new incoming service, and Helene has been she's been really effective and really helpful here. I motion to the side because she's always sitting at this chair here when we meet. She's always been really great. So I really thank you, Helene, for all the hard work you've done. She has been on the board since I started. So I wanted to just send my sincerest gratitude and thanks. And I look forward.
If I go this way, because she was there, she was one of the original members and done a fabulous job. And I agree with you. We all owe her significant thanks. The whole community.
I would say the same, and it's been a quick 9 years. It's gone like that. And
has it been 9 years?
Yeah, 2011. We were all.
Wow.
So Helene, thank you.
Unbelievable.
9 years. Maybe we should have term limits on the board.
So Helene, we have your your nameplate here. So when you want it, we can come and you can come by and pick it up, or I can drop it off with a nice bouquet of flowers from all of us.
Absolutely.
And that's it from me.
Uh,
And we look forward to having Melissa and Meredith on the board. So thank you so much.
yeah, thanks, Melissa. Congratulations.
Thank you.
Thank you. We haven't done the voting of the committee assignments yet, but I'm very interested and I hope that I can work with you all. You do such good work and such important work. So I'd be honored to be a member of this team. Thank you.
Excellent.
Well, anybody else got anything else on your mind? When's our next meeting, Roberto?
So our next meeting is the normal meeting for July. So that would be July 16th, and that would be at 4. So we'll be back to our normal.
One thing on the regulation 51, was that at that meeting in July, or did we extend the public hearing? Did we?
Yes, July 16th. We did push the public hearing on July 16th. You're absolutely right. Yeah. Wow. Has it been 90 days already? Just like Jim said, with the 9 years, 90 days with this COVID thing has passed by. It's been interminable, but it's been so fast at the same time. We stuck 8 years worth of work in these 90 days that felt like 9 minutes. So I know, Melissa, you had your.
Go ahead, Melissa.
Thank you, Steve. I'm new to this today. As far as I'm aware, this is the first presentation of CrowdRx, and so I'm just curious what the next steps in consideration are. I'm assuming that if we're going to use a service like that for this summer, that's something that will need to happen rather quickly. I didn't see any information about costs, and so what is the sense of this board or next steps, because it wasn't clear to me. Thank you.
My understanding was that CrowdRx was discussing today just as this is an option that the town has. They're already here doing testing. I believe they did the testing at one of the yacht clubs. So it's an option that's here. If people want to do testing privately as well, they have that. In a discussion with Dr. Bazos, he did mention that they're going to be working on getting us data as well so that we can get that into our Maven. So right now I think if we would need to request a quote, I believe it's similar to what the hospital already offers, which is $150 per test. I think it depends on what the volume of people, but the cost of PCR is unfortunately the cost. So it's usually between $125 and $175. That's what I've seen across the board.
Yeah, I think that's going to be, another discussion with the select board and us, maybe down the road. Do you have another question, Melissa?
No, sorry, I was scratching my head, but not because that was perplexing. I do see that. I worry a little bit about the timing. Some of you may know I am in the property management and rental business, and starting in the next week or two, the influx of people coming to the island is only going to continue to grow, and it will be beyond seasonal residents. And I think as Dr. V mentioned, we'll have seasonal residents returning from some high impact areas and areas that are starting to see some new disease growth. And so if there was consideration that this was a valuable service for us to use at points of entry on the island or have available at points of entry, I think it would be good to have that conversation sooner rather than later, but I'm not sure. Again, I'm very new to this conversation, and I really defer to you all on what your sense of the program is and how quickly we should be considering something like that.
It's a good point, especially coming into July here. I mean, it's a good tool to use. I think we'll we have to leave it at that at the moment. And we don't know what costs are.
Yeah. I think it depends on what sort of project we're looking to do. If it's just going to be screening, that's going to be one quote. If it's screening and PCR, it's another cost. I know with the hospital we've already dedicated $100,000 to the hospital for the PCR. So it's town funding isn't endless, and that's the hardest part.
And if we did say screening of people getting on the ferry, I mean then you've got to deal with commercial entities and as he pointed out, screening and oxygen, you're still going to miss people. So
Yeah.
I think this would be great for a private company or institution that should know about it. I'd have to think about how we could use it from a town perspective, where the money would be worth the cost.
Right. Anything else on your minds? Good, Jim?
I'm good.
Good. Okay, I guess I get a motion to adjourn the meeting.
I'll make that motion.
I get a second.
I will second that motion.
Okay, all in favor by roll call vote. Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
Steve Visco, chair says yes. Okay, thanks for coming. Thanks for attending, Melissa.
Thank you for having me. Have a good day, you guys.
Okay,
Welcome. Thank you.
Take
see
care.
you guys.